All right. Now, does Tylenol cause autism? What does the literature say? I'm Dr. Nick Pappas, board certified orthopedic surgeon. Now, this has been a hot topic for the past several months. If you look at the literature, and I've looked at all the studies, and everyone will say, oh, well, there was a study at Harvard, or there was a study at this other well-known institution that showed that it was causally related to autism, that Tylenol during pregnancy caused the autism. That, in terms of the studies and the literature that's out there, is actually not true. I have not seen one study so far of all the studies I've looked at that shows a direct causal relationship. Causal relationship is different than an association. Association just means that the two kind of happen at the same time relative to each other, but it doesn't establish a cause and effect relationship. Most of the studies on Tylenol and its relation to autism in pregnant women are observational studies, meaning you just kind of looked at data that's already out there. Okay, I have not seen, and I don't know if they've ever even done a randomized controlled trial on this, where they give the subjects an exposure. In this case, one would get Tylenol, the other would get some sort of placebo, and chart the outcomes to see the eventual development in terms of percentages of autism. And so I have not seen a study like that, and those are the kinds of studies that typically establish causality or cause and effect relationship. So when you see these headlines that say that research has shown that Tylenol causes autism, that is not exactly true based on the literature, okay? And again, we may do a study and it may show something along those lines, but the reality is if you look at the current literature, there has not been a study that established a causal relationship between acetaminophen exposure during pregnancy and autism. And that's just the reality of the literature. And some may say, well, you know what? The literature isn't good enough. I've seen it in my own experience. And as a result, I think that the literature is wrong. You're certainly entitled to your own opinion, but that's what the literature shows. Okay. Now, what I would take from this is I still personally try to limit my exposure to any medication unless it's absolutely necessary. So do I take Tylenol for headaches or acetaminophen? Yes, but only if it's absolutely necessary. I very rarely take anything if possible. Now if I had some sort of life-threatening situation and I needed, an antibiotic or, needed to take some sort of blood pressure medicine, absolutely I would take it. But I don't want to take a medicine unless I absolutely have to. So the take home from the whole Tylenol autism debate is really that you should just limit what you take unless it's absolutely necessary. Because all medications do have some degree of risk. If they didn't have risk, they wouldn't have positive effects. So it all kind of goes together. Anything that works is going to also have a side effect. So keep that in mind. And if you enjoy this type of evidence-based discussion from an actual practicing physician, board certified, licensed in the United States, follow this channel and I'll have more of these types of evidence-based discussions so you can know what the evidence is and then ultimately make your own decisions as to how you want to handle certain things like when you get a headache or if you have pain.